Welcome everyone to the SHSMD webinar, Building the Digital Front Door, the Mayo Experience. This webinar is being recorded and is broadcast in listen-only mode. SHSMD would like to extend a sincere thank you to Accenture for sponsoring today's event. Before we begin, please locate the chat pod on the bottom right-hand side of your screen, and at any point during the presentation today, feel free to introduce yourself, enter any questions you have, or share ideas as we have allotted time at the end for Q&A. Now, it is my pleasure to welcome our presenters today, Tim Faber, Operations Administrator, Office of Contact Center Management at Mayo Clinic, as well as Victor Abiad, Principal Director, Provider Consumer Experience for Accenture. They'll share a little more about themselves before diving into the content today. Over to
you. Thanks so much. This is Tim Faber. As was mentioned, I'm an Operations Administrator at Mayo. I have been with Mayo for 20 years. I just hit my 20-year anniversary this fall. I've held a variety of positions, both in some of our diversified areas, and then also I had a fair amount of experience in our access and scheduling teams. So our Office of Access Management, working in both Rochester and across our community practices in the Midwest. Victor?
And hello, good afternoon. I'm so happy to be here. My name is Victor Abiad. I'm a Principal Director in Accenture's Provider Consumer Experience practice. That's part of the Health and Public Service practice. I've been working in industry for over 15 years now, 7 of those with Accenture. I also spent some time in the corporate world with a health insurance company to round out my experience. And so today we're here to talk about the digital front door. The way our presentation is structured this afternoon is that I'm going to start and share a little bit about the latest research and work that Accenture has done in this space. And then we'll turn over to Tim and to talk about the work that he's doing in building out the digital front door at Mayo Clinic. Tim, anything else you want to say before we get started?
No, just appreciate the opportunity and looking forward to both the presentation and the questions.
All righty. Okay, let's get started. So how are we doing as an industry? Here's some statistics that we've picked up from our latest research. Overall, really, it's not too good. About a third of patients say they're not satisfied with their current healthcare provider. Luckily for us, not all of them acted on it. There is some stickiness that makes it harder to switch. So in the past year, only about 20% actually switched. Now, why are they not satisfied? We have multiple data points on this one, but I just highlight a couple here. When we asked patients what proportion of them say it's important to get an appointment at a convenient location, 90% of them say yes, that's very, very important. But at the same time, only about a third of them said that they're able to do that with their current provider. Another example to share here is that the third on the right side there, about 77% of patients say it's very important for them to be able to book appointment when convenient, so preferably after hours or on the weekends. Unfortunately, about the same proportion said that their providers are not able to do that for them. So where should we focus for maximum lift? Accenture does this provider benchmark study annually, and these are the results from last year. Actually, we ran this early this year, but this is just before the pandemic, so need to account for that. That said, the results have been very similar the past few years. And when you ask the question, where should they focus on for maximum lift, we often tell them it's really your digital front door. So let me orient you to this slide here. On the x-axis, these are all the different touch points that the patient goes through as they interact with a health system. And on the y-axis, it's It's the Net Promoter Score. So just one way of measuring satisfaction. Um, but when you look at it, the one that has the most impact on on satisfaction would be on the very left here. It's receiving services. That makes sense. It's when it's the interaction of the patients with their doctors or with the caregivers when they're actually receiving the care. That correlates very highly with satisfaction. If that's a good experience, then you get a higher Net Promoter Score. Um, and what we've found is many of our provider clients, they do focus a lot of their effort there when you have a patient experience um, program. It's often measuring that experience of the patient when they're within the four walls of the health system. So good thing there that a lot of effort is placed there. What's interesting is that the second and third place in terms of the touch points that impact satisfaction are scheduling an appointment and finding the provider. So in that box here on the left side. So what we're calling the digital front door. What we've found is quite a few of our provider clients don't really pay attention that much to the care outside the four walls. So what happens beforehand? They will have a question or two there, but there's not a concerted program to design and manage that experience before they become an actual patient. The unfortunate thing, of course, is if that you don't please them and you're not able to help them find a provider easily, or if they're not able to schedule that appointment, then you may never get the chance to please them by providing the care for them. So where to focus for maximum lift? We'd suggest here's the place to focus on, the digital front door. And how do we do that? What do we need to do to get this right? You need to do three things to get it right. First, you have to create the demand. Second, you got to capture the demand. And third, match it to capacity. And you have to do all of these right for it to work. This being SHISHMED, I think many of you focus on the left side here where you created demand. This is how do you create that buzz so that how do you create that name recognition so that when Victor gets sick or Victor moves to a new place, that he thinks of your health system when he needs a provider, when he needs healthcare, that when he opens up his computer, what he Googles is the name of your health system, or when he looks up a number and when he dials the number, it's a number to access your system. So that's part of the things you have to get right. But getting that right by itself doesn't get you all the way. I'm working with a colleague now who just pinged me last night. Said she's working with a chief marketing officer of a health system in the Midwest, and she said he's complaining because they're not that he's not able to convert their leads. Well, it's because we need to get these second and third pieces right too. And so the second piece is capturing the demand. And here you focus on the right time, the right location through the right tools. And so here, if you think about it, this is making sure you've got the right tools so that if they prefer to use the portal or the website, they can do it that way. If they prefer to use the phone, they can do it that way. And that you're able to, if they decide to call, you're able to answer the phone quickly in a friendly manner and engage with them intelligently. If it's through the website, that your website is easy to use and it's frictionless, so make it so that it's an easy experience from them. But even there, just getting that right doesn't make it. You have to get the right side of this also, because in the end, even if you answer the phone quickly and you engage with them in a manner that's pleasing, and if you're not able to give them the appointment they need and where they want it to be, then they might not be completely satisfied. So in the end, you need to get all three right, and that's what will help with that digital front door. Now, where we're going to focus on when we talk about the Mayo experience, that project is what we call Project Contact Center, focuses squarely on the middle part here about capturing demand. So let's talk about trends in contact centers. And here's 5 trends that have been going again over the past few years. One is that expectations are set across all industries. So the expectations for your health system, for your contact center, they're not set by you or by the health system down the road. It's set by the user's experience across all of their across all the industries, across all of their experiences. So they're kind of used to interacting with Amazon, where everything's available at their fingertips and it's quite easy to find things. They're used to Uber, where paying the bill is as easy as shutting the door. Second is digital, but not all digital. So here, think about it as engaging with the patients through the channels that they're most comfortable with. If they're comfortable using a digital channel, hopefully that's available to them. If they're comfortable using the phone, hopefully that's available to them, and that the experience is consistent across the two, that the answers they get across the channels are the same. And because they might start their interactions with you on one channel, but then complete it on another channel. Third piece here is about being experience-led for customers and employees. And here, thing to think about is the technology gets you just part of the way there. What really makes it worthwhile and where you get the value for the buck is designing that technology with a user experience in mind. And this just becomes more and more important as the technology gets more sophisticated, as people get more sophisticated in the use of their technology. Fourth one is that contact centers are becoming customer managers. And this is because as technology improves, the simpler tasks are getting automated. So people are able to do things on their own through self-service, which leaves the more complicated, the more complex stuff to your agents in the contact centers. So they really need to be problem solvers. They really need to help to understand what the challenge is and understand how to help the callers. Lastly, it's digital from the inside, and this again something that's been growing on over the past few years. It's all about how technology can be used to interact with the patient. So virtual assistants for self-service. It's technology that makes the agent's jobs a little easier. What are the things that you can do? What are the tools you can give them to make their jobs easier? And it's also the insights that digital processes allow us to get now, and which fuel continuous innovation and continuous improvement. And then lastly, it's about automation just to make these interactions as efficient as possible. So when you think of your contact centers, what again the big things that happen there, the big touch points? It's a digital front door. People trying to figure out who's the right provider for me, and getting the appointment for them. But those first two on the left I mentioned, some make up the bulk of it. But of course, there's oftentimes the revenue cycle component of it. So it's what do I owe? Can I afford it? Am I covered? How do I pay? What will my insurance cover? What will I be responsible for? So there's that component as well. And then over to the right, it's what's next. It's after the appointment. It's the post-care plan. If they have questions on the care, if they have, say, to schedule the next appointment, or if it's around wellness, don't forget about these as well. So that the digital front door is very important, but there are the rest of the activities as well, because you might disappoint someone downstream and they might never come back. So that's just a little bit of our some of the findings from our research. Now I'd like to talk about turn over to Tim to talk to you about the experience at Mayo.
Thanks, Victor. With this slide, I think the major takeaway is that we have staff and patients that span, several states. We have community practices, our destination medical centers, and I think at our operative Midwest from an access and scheduling standpoint, partnering with our executive sponsor, Susan Eulenkamp, who had a background in finance, and we really wanted to not only think about where we're heading and really expanding that digital front door, but we also wanted to take an inventory of what did we have in our current state? How are our contact centers structured? What tools and support did they have? We know that we were doing some exemplary work, but was the right support there? Was the right technology there? So again, it started as a project. It started as sort of an exploration of what was our current state, and after some very solid work and understanding that, connecting with folks across our organization, we were able to lay out a strategy, and one that's inclusive of not only our access and scheduling. So as Victor was talking about, capturing the demand, but also across our contact centers, because we partner and we do that on behalf of our patients and also our employees. So our project quickly grew to be a fairly extensive effort. So the focus on the contact centers, and I think it's good to kind of reorient why did we focus there, and why did we focus in the way that we did. We're an organization that we have a very specialized practice, and with that specialized practice, some of those patients require a higher touch. Others require some things in a pre-visit fashion. There's coordination post-visit. There's existing and returning patients. And as I said, we're also looking at some of our contact centers that work with us as employees. So as we look at that, we know that there's a high degree of specialization, and we knew that we would need to have an approach that really met patients where they wanted to be met, and also had an approach where we matched our communication channels with what their needs were. And that led us to really look at, we had to have a prioritization of the highly complex. We need interventions that work with our moderate and also from a population health standpoint. And I think what we were able to do is really land on an approach that focuses, kind of across that continuum. It allows for some of the tremendous work that's being done in our access and scheduling world by our Office of Access Management staff. We have efforts happening with our digital health colleagues. Individual departments are moving some things forward. So we want to make sure that we have an opportunity to encourage those improvements. And then we also need a coordinated strategy so that there's alignment and that we're working collaboratively in that space, because ultimately we really wanted to focus on the patient journey and making sure that there was a consistency there, and one that represented Mayo maybe regardless of point of entry. So with that journey in mind, we knew that we would have self-scheduling or digital interventions, but we also knew we wanted to make sure that we had an approach where there was a human touch when needed, and a way to really connect with our staff in whatever mode the patient chooses. So to do that, we really focused on our current state platform, which leans heavily on our telecommunication structure and the tools present there. So, I don't mind sharing that we had some opportunities to improve. That being said, my background, as I mentioned, access and scheduling, I have tremendous, I'm continually impressed by the work that our staff do. And they're often the first connection at Mayo. They're often coordinating some things that are really challenging for those that are contacting us. And so there's a lot that works. But we also, as we worked through this, we understood we've got multiple points of entry. We've got multiple points of entry for new patients. We've got points of entry for our existing patients. We have a dimension, like I said, with our own employees and what we expect. So we took an inventory and looked at sort of, where do we have our functional areas? What are the channels of communication? What are the emerging channels? And really, I think we came to conclusion that this is an effort worth doing. And with our partnership with Accenture, we were also able to gain some understanding of what's happening at other locations, what's happening in other industries, and it really helped us lay out a cohesive plan. I think the piece that I would also offer is that we found that there were really, best practices, and there were groups that were doing some things that were really, really positive, but it was pockets. We didn't have a scalable approach. And when you think about individual departments bringing in new tools and technology, sometimes that's a really limiting environment based on what they're able to justify. So as we looked across, we saw a wonderful opportunity to really enhance what we have in the way of technology, but also the tools and the best practices that we can support those folks. So with that, we really said, okay, let's take a look. What's the structure that helps us get from where we are today to where we need to be tomorrow? And tomorrow is kind of literally tomorrow. We really need to make sure that we've got an eye to our future state. So with Accenture, we partnered in top of the building there is the patient and staff experience. So we wanted to keep that at the forefront. Wanted to make sure that we had that in mind across. We've got wonderful support from our Center for Digital Health. And so with that, we were able to think about what would be the right kind of approach to work across all of these different domains and areas. And you'll see that we've called out a few, but we have a large number of staff, thousands of people in contact centers across our sites and across our departments. And some of those are the scheduling areas that were highlighted, and certainly that's the lion's share of our phone and contact center work today. But we also have folks in our nursing areas that are supporting contacts to Mayo. We've got a sizable lab practice, our pharmacy colleagues. Revenue cycle is a major component of the patient experience. We want to make sure that we've got a consistent approach there. And as the others, what I will say is that we found more colleagues in contact centers than what maybe our original scope was. And so we continue to find groups that benefit from this approach. And what is this approach? Well, we're rolling out new tools and technology that really support the telecommunications infrastructure. We're providing some updates there that, quite honestly, are needed, and they're also foundational to what we want to do in our next phase, which is really that focus on more of a digital presence. We have some, but we want to make sure it's accentuated. And then we also want to make sure that we have an opportunity to meet patients in what channel they wish to contact us in, but also have strategies where we're able to maybe switch channels when needed. And that's where the technology comes in. But the technology is one solution. And without a group that's really in a position to move that forward, we felt that we'd be missing an important component. So again, through our partnership with Accenture, we identified that we needed a center of excellence. And that's part of the reason I'm able to be part of the presentation today. Is my role is standing up our Office of Contact Center Management. And it really is an area that we're finding that we were filling a needed role in our organization, and it's one that spans our departments, and it helps make sure that we're translating the technology for what we do today, and that we're partnering with those that are moving us forward, and we're also initiating some of what we need to have tomorrow. So it's been really positive. I think when you think about the patient and the staff experience and the contact centers, it's a very busy environment. People are working very, very hard. So to have a group that's focused on that has been really, I think, important, and we're finding value. That's not to say that there are people on the team that I'm working with. They've been doing this work for years, but they were doing it in a given department. They were doing it with a given focus. And we're finding tremendous value in starting to look across different technologies that we're deploying, whether it's call recording and staff scheduling tools, or focusing on some of the acceleration items we're doing from a digital standpoint. So really having a group that spans and focuses on that contact center, that puts us in a much better position to meet some of those challenges that Victor outlined earlier in the presentation. So where are we at? Our project in our department really wanted to make sure that we did a comprehensive view and also a comprehensive improvement in our telecommunication space. So you'll see call recording, workforce management, call monitoring. That's not to say that those weren't present, but they weren't present with a consistent tool set, and they weren't present across our departments and sites. So again, we had pockets of excellence with those, but not something that was scalable and available across our units. So that's something that we would consider the basics. We need to have that present. And now that that's present and we're able to do that, now we have an opportunity to really enhance and influence a more consistent patient journey, just even with that starting portion of our wave. We're also looking at making sure that we've got some of the other items from a telecommunications standpoint, call routing, making sure that we're routing folks based on what we know, not necessarily depending on an individual to do that. An agent desktop where we're able to have a consistent approach to the information, pass that between colleagues. Outbound dialers, we think there's a place for that. Certain campaigns, that's still a place where we find some benefit. Our IVR, sure, we have some opportunities in our current state. We do some auto attendance and things like that, but we know that what you actually have as far as the information within an IVR, that bridges and does some things very similarly with a digital presence, whether it's chat, things along those lines. And then with COVID, virtual hold is something we obviously really focus on trying to make sure that we're reaching patients and they're reaching us in an expedited fashion. But there are those times where things just aren't as planned. So offering an opportunity for folks to receive a call back when it's more convenient. Those are all things we thought should be present in our approach to the phone, so to speak. But then we're also doing some pilots. We're learning with some innovative efforts around more automated resulting for test results, some virtual assistance, so guiding some things virtually, two-way texting, payment reminders. And I think that points out too that while my focus is on contact centers, I'm also working with colleagues across our organization that are focused on developments in their space. So whether that's more self-scheduling options or more algorithmic triage via the web, those things are still going to happen, but we also have to have that connection to the contact centers. We need a platform where that's possible, and we need those connections so that those folks that are doing the work can partner. So again, we're driving this with an eye to our future, but we're also doing that in collaboration with some colleagues that are doing some pretty tremendous work in the current state. So where does that leave us? Well, we're on the path. And what we've learned so far is that it really is an investment in the organization. There's always a focus on technology. There's folks that might see a new tool or a new approach, but without the infrastructure and the expertise underneath that, the impact of that new piece of technology is going to be limited. So we feel very fortunate that we have the investment, not only in the technology, the tools, but we also have a staff supporting this and able to do the translation to our various units. We obviously had existing partnerships, but we found a real benefit in the enhanced partnership and with the Office of Contact Center Management, that partnership with the business units, our telecommunication colleagues, our internal IT development teams, we're finding a lot of efficiency and a lot of effectiveness of having those folks at the table together. And we continue to do that. And again, with Accenture's partnership, we have a variety of folks with a variety of focuses, and we're finding we're able to do some things in a more agile environment that's moving us forward. We're learning as we go, and we're making changes as we see fit. We also found that we have a lot of data. We have a tremendous amount of data, and we need to use the data we have. There's always a need for more or a different dimension or a different view. But using what we have, we found an accuracy in not only where we identified areas of improvement, but also it's helping guide what we're doing in the future. And I would say that the focus on the long term, really laying out a capability wave and focusing on what we saw as our foundation, which is our current state. We're leaning on the phones heavily, making sure that we invested there, that we see what that next set of capabilities are with an eye to the future, has been really, I think, powerful. And for the staff that are working in my unit, it's also helpful because they understand that the work is continuing, and we're going to continue to work in that space. And it's been a very just a very rewarding place to spend some time. And as somebody who's been around contact centers for a couple of decades, it's work that I personally, had long waited to do, and I think a lot of the colleagues I'm working with felt the same way. So we're finding a lot of enjoyment as we do some complex and urgent work to support our practices and support our employees. So that's what I had in the way of slides. Victor, anything that I might have missed as we navigated the slide deck
I don't
together
think
there?
so, but I think we should just open it up to the questions.
Very good. Thanks.
And thank you both for that excellent presentation. We do have some questions in the queue. The first one is, some of the biggest challenges faced are how to get the work started. Can you tell us a little more about how you got this work underway?
Sure. I think initially it started with some very strong support from some executive sponsors and wanting to make sure that we understood where we were at. There's a lot of investment and a lot of awareness of what we need to do in the future. So to get started, we needed that senior level leadership buy-in. We needed to do a good amount of work to understand our current state. We found that partnership with Accenture was helpful in identifying where those opportunities are. Also, contrasting that with other industries, and that really started a lot of energy, a lot of excitement, and not only from the operational teams, but also from our practice leaders, our shared services leaders, because they started to see the opportunities that were in front of us. So I think to start, it really required a good, strong investment from our leadership. And then it also required getting the right stakeholders that really understood where we were at and also understood where we needed to be. And a few of those steps early really set us up for success.
Yeah, I think one of the things we did early on when we were doing the assessment was we did a secret shopper analysis where we compared the experience of trying to get an appointment at Mayo Clinic to the experience at at some of your competitors, and this was very useful to highlight how the experience was different. There were some aspects of it that were better. There were some aspects of it that could be improved, but I think the biggest thing there was it just highlighted to multiple leaders that, hey, this is an area that that really can improve. There was an underlying feeling that this is an area that could improve, and by doing that, it shone the light and confirmed a lot of like they had a feeling that this could improve, and now they had confirmation. And so I thought that was one of the key things that we had done to help build excitement, help build awareness about wanting to address this. And I think that was one of those things that got people excited, got people aligned on around the problem. And then once we had that, it was just a matter of then getting once you had people's attention, it was just a matter of then putting a plan together, showing what needed to be done, and laying a roadmap that people could get behind on.
Wonderful, thank you. The next question is from Justin, and regarding the contact center employees. Did any of them voice concerns around this strategy or solutions proposed in Wave 2?
Yeah, I can offer a little bit on that. I think our staff are understanding that they're pulled in many directions, and with some of the opportunities, we've really emphasized that it's a patient experience investment, that we're looking at the patient journey. And a lot of our stakeholders around the table identified that we needed a different approach here, because our folks could take a higher touch approach when possible, that we had additional work that we could get to that maybe folks weren't getting to. So as we looked at some of the more basic automation opportunities, we also wanted to make sure that the staff knew that there was additional work that we could accomplish. And I think there's been a lot of excitement because we've also acknowledged, the other efforts. There's things that are beyond just the inbound call that our staff are doing. They're often pulled in many directions. So as we look at some of the enhancements, it's also looking at that operational story of what else they might be able to prioritize and the additional value work that they're able to get done. So it has come up. It's something we're aware of. And we have a really, I think, comprehensive approach to change. We've got stakeholders, large groups that get together to hear what's coming, to think about what that impact is, to inform those areas as we also navigate decisions up and cascade information down. So change management's been really important, making sure that we understand the impact of the staff, that they're part of this, that they see the opportunities to do more value add work as some of the more simplistic tasks are addressed. We've had really good buy-in, and that's not to say that there won't be concerns, but I think we have a structure to support and deal with that when it does arise. Victor, anything
Yes,
additional from your
I think
perspective?
that from the beginning when Mayo approved the investment, it wasn't to get savings. It wasn't to get it was first and foremost to improve the patient experience. And with that in mind, I think when you couch it in that we're doing this to improve the patient experience, I think most people got behind it from the very beginning. The second objective when with approval of the investment was really to support the digital strategy. I think that part people kind of get, and it's always exciting because, oh yeah, that's the way of the future. But I think there's more the people can relate more, make that emotional connection and understand clearly why we're doing this is when they think that everything we're doing is so that we can serve the patient better. I think that kind of gets them on board.
Thank you. The next question is from Deanna, and she was wondering if you use CRM technology or if you integrate CRM data at all with your contact center uses.
So it's a great question. It's one that we've spent a fair amount of time on, and this may resonate with others, but we actually have multiple CRM systems that we're integrating with. So with our contact centers, we needed to take an approach where we acknowledge that there are different tools that supply a better support to staff. So we identified that. We knew that looking for a standardization would be optimal, but maybe not likely to meet our timelines. So we're choosing to work with a variety of sort of systems of record, and we're looking at building an approach that provides a layer where there is that interaction, but yet there's a common approach across our contact center. So it's a great question. It's one that we're working through. We see great opportunity in the approach that we've taken, but yet, still some work to do there.
We said we're starting onto wave 2. A component of wave 2 is the CRM strategy. As Tim mentioned, there are multiple CRM systems that are in use at Mayo, and we're trying to figure out what are the uses, what are the gaps, which of these will be the one that we want to go with in the future, or do we go with multiple ones in the future? One of the big reasons that we did not put CRM early on in this process is that one thing we've seen at one things we do with our other clients is we use the CRM to build a way for the agents to match callers to the proper appointments. To be able to understand, because if you think about it, if for many systems, the agents have to kind of decipher and interact with the caller, and based on their symptoms, figure out what kind of appointment they need. And what you're doing is you're putting a lot of decision making in the hands of your front line. And so what we've done with other systems, with other health systems, is we build out this decision trees actually, and we often use CRM systems like Salesforce.com to build these decision trees where the agents have yes no questions that can be answered with a yes and no, and based on the caller's answers, guide them through to the proper type of appointment. At Mayo, they built this already in Epic, and so we did not need to build out a CRM system for them. That's why we pushed it off to the future. Like, hey, they've already got a lot of that in place. We don't need to focus on that. There's other things we need to focus on. But CRM systems are a big part of the solution at other of our clients, just not here at Mayo.
And for us, I think it's just a matter of identifying we're working across patient-facing and also internal contact centers. They have some slightly different needs. So with an inclusive approach, we're looking at interfacing with multiple systems.
If I may add to, like,
Wonderful.
when I talked earlier, we had like multiple parts. There's the actually, let me take you to that slide where we have the create the demand, capture the demand, and match the capacity. The use of CRM in the middle part is what I had just described about how do we build these decision trees to guide the agents when the call comes in. We do a lot of work and use the CRM up here also, where we have an interface between the marketing group and the contact centers. It's more which campaigns do we want to launch, the work in marketing to identify the segments, the services that we want to do campaigns on, and then use your contact center to launch those campaigns, and be able to make sure that you're able to catch the demand when it does come in. So that's another use case for CRMs. Not particularly, we're not doing it right now at Mayo just because they had it already, but we're doing this at others of our other clients.
Thank you. The next question is from Ken. Can you shed some light on how you are managing the increased call volume during COVID?
Yeah, sure. Really challenging, I think, for everybody. The statement is, I wish we would have done this work a couple of years ago. We would have been in a better position. But part of, I think, the value of the team that I'm working with is we were able to really focus in our current state. So while we have some things planned where there would have been more elegant solutions, we were able to address a number of the needs in our current state environment. So that entailed additional staff working to provide some triage. There's been some work in our access teams to do some things in the self-scheduling and to help aid in sort of the algorithms to walk through. We've done a lot with some routing between teams so that there's things that are done in our phone space as far as working collaboratively. We've done some automated resulting so that things that didn't require a higher touch, that we look for a more automated approach to that work. So our project really did pause at the onset of the pandemic. We reinitiated in August and had our first go lives in September. So the project work took a pause, but the team I work with really spent a lot of time working with our scheduling colleagues, our nursing colleagues, to help them with current state, whether that was staffing models, different approaches, different workflows. We spent a lot of time in that space. So I would say that there's clearly some tools we have planned that would have probably worked a little bit better than what we did, but we were able to meet the organization's needs and add some additional support in some places where folks really needed it. So again, a lot of existing tools, and then also some creative solutions through our colleagues in Access.
And the last question we have is, do you have any tips for setting up a good team to have good cross collaboration?
I can tell you what we did that was successful, but Victor, I know you have some perspectives on this from other
No,
organizations as well.
you can start, Tim. I'd love to hear it from you first.
So yeah, so that to really identify the cross-functional team, it's having an understanding of who are the stakeholders and who has not only a group that would benefit from this work, but what are those areas that provide the functionality and have the technical expertise. So we looked at very much a kind of an approach where we're working with some of our technology experts. We've got telecommunications around the table. We've got a pretty expansive change management network where we're interacting with the various departments, both with sort of the local experts, sort of their advisory group, which includes a lot of their leaders. We have a steering committee, including senior leadership, so that we've got a structure on that side. But when it really comes down to the team, it's having the experts at the table. It's having a cadence to that work. And one of the things I'll offer that was really important was we knew we had some folks that were doing some of this work were experts in individual departments. One of the things I wish I would have been able to do a little bit earlier is bring those folks together with really a dedicated view of working across. Now that we've got a team that's working across the various business units, we're finding a lot of just benefit in the connections that we're making. So I would say the fact that we have people that now their focus is on this contact center work, we're finding that to be a differentiator around the table with the cross-functional team. But we started with experts. We started with the folks that would be benefit, but we've evolved in that investment not only in technology but in a center of excellence. I think is really paying dividends at this stage in our project. Victor?
Yeah, I think in terms of how we got the team built, I'm thinking of the broader team, including the stakeholders and the business units. And I think it had to do, one of the big things that you did very well was engaging early and engaging often. And it was communications across multiple channels. There was those groups that you mentioned that would meet monthly and would be able to get input from them, provide communications to them. There was also the project website and Yammer that we would use to disseminate information and gather questions. So I think I think one thing about the team, building that team, is that it's all about communication and getting clear about what's happening, getting clear about roles, who's doing what, and just over communicating at some point, just to make sure that everybody's on the same page.
In both the current work and where we're headed too. I mean, we were sharing what our future state vision was from the very, very early interaction. So a lot of transparency in what was going on, and that was shared across work teams and team members from the very beginning, which I think helped us, all kind of come together on the work that we had ahead.
Fantastic. There are no more questions. A few requested copies of the slides, which can be made available by completing the post-event survey that pops up after the webinar today. I want to thank Tim Faber and Victor Abiyad for that excellent presentation. I want to thank our sponsor, Accenture, for sponsoring today's event. And I want to thank all of you for joining as well. As I mentioned, we would greatly appreciate your feedback via a short survey, where you can also request a copy of the slides and more information. Thank you so much, everyone.
Thank you.
Thank you.